This vaccine has shown dramatic results in many patients, but not all of them. In some of them, the cancer continued to progress. And so we're working on understanding why it doesn't work all the time and making it better. I'm just going to show you a couple of remarkable patients that we treated.
Okay.
Here, for example, is the third patient we treated. He had a PSA of 330. The man we did surgery on today, his PSA was less than 10. So 330, much higher. And he had enlarged lymph nodes throughout the body that had cancer in them. And we could measure them, and we measured them. There were 8 of them. And then we started giving vaccines. And within 8 weeks of giving vaccines, these lymph nodes, these cancer-filled lymph nodes, began to shrink. Look at this one, for example, compared to this one 12 weeks later and 52 weeks later, much smaller. And it's also darker, meaning it's dying.
Okay.
And here again is a tumor in a lymph node. And then here, 12 weeks later, it's much smaller. And if you measure the long and short diameter of all of the tumors, they got smaller. After each one of these is a vaccination. So we did 6 every other week.
Okay.
And then we did 1 every 8 weeks. And you can see over the course of 1 year, everything got smaller. And so this patient, who was in a wheelchair and was in severe pain 2 years ago, he goes fishing every day now. So for him, it's real today. Here, for example, is a patient who had a PSA that was shooting up like a rocket. And after some vaccine and other treatment, his PSA is 0 and it's staying 0. And his cancer in the lymph nodes, in the liver, was all gone.
So it's not only for prostate, it can go to any part of the body.
This is actually prostate cancer that spread to the liver, that was now eliminated when we combined some vaccine with some chemo together. And here's the last patient I want to show you. Again, I told you the patient this morning had a PSA of less than 10. This patient had a PSA of 1100.
Too much.
And rising fast. He had failed chemotherapy, and he got 1 single vaccination. And within 24 weeks, his PSA had dropped 90%. And his bone scan, which showed cancer in the bones, improved. So this is the beginning of evidence that with the right technology, you can stimulate the immune system to fight cancer even when it's spread. And it's a vaccine, even though most of us think about a vaccine as preventing something.
Right.
But here we're giving a vaccine to patients who already have advanced cancer, and we're showing responses. So with any new treatment, you usually start testing it in the worst cases because that's the way developing new treatments works. But if you can show that it's working in the worst cases, then it usually could work even better in the early cases. So maybe in a few years, when a man has prostate cancer early, instead of needing robotic surgery or radiation, maybe we'll just give them a vaccine and that'll be all they'll need. At the end of this year, we'll start testing a new group of patients with a more advanced version of this, which is 10 times more powerful in activating the immune system. So we're hoping that it'll work in more patients, and that's the goal, to test it.
Who's a candidate for
Right
this?
now we're treating men who have prostate cancer that's spread. They're already failing hormone therapy, and their PSA is going up. So it's patients with advanced cancer failing the standard treatment, which is called hormone therapy. And we'll be opening this trial again towards the end of 2011 for those types of patients, and we're hoping to enroll close to 100 of them.